Okay, I'm gonna knock. Hi, my name's Ava. I'm going to be your nurse today.
Okay.
We're gonna do a head-to-toe assessment on you for the doctor, okay? So, bed is in lowered position, locked, call lights in reach, belongings are in reach. Can I see your ID at the end? Can you give me your name and birthday?
Audra Berman, February 2nd, 2002.
Okay, thank you very much. So as I'm doing the assessment, I'm going to note her general appearance. So if her age is appropriate to the way she looks, personal hygiene, if she's got speech levels that are appropriate, and if she's got good hearing, her attitude, if she seems like she's in any type of distress, anything like that, and I will put that in my charting. So why are you here today?
My knee has been hurting.
Okay, so can you tell me what helps or hurts your knee?
A lot of pressure on it and using it all day.
Okay, what makes it feel better?
Relaxing and keeping weight off of it.
Okay, and what does that pain feel like? Can you
It's
describe
like a
it?
pinching feeling.
Pinching? Okay, so you said it's in your knee. Does it radiate anywhere else?
No.
No? Okay, so on the scale of 1 to 10, 10 being the worst pain ever, how severe do you think your pain is?
6.
6? Okay, and how long has this been going on for?
About a year.
A year? Really? It's crazy. Can you tell me why you think you have this knee pain? Like what happened, you think?
Soccer, I got collided with.
Okay, in the wrong, so a little wrong direction hitting there.
Yes.
Forgot to grab a piece of paper for my notes. Okay, so up next I would usually take weight and height, but I don't have that stuff here to be able to do that. So now I'm gonna do vital signs. Yeah, that's the word I'm looking for. All right, so we're gonna start with your pulse, your oxygen saturation. Go ahead and rest your hand for me. Okay, it's a 99. And I'm gonna do your pulse. Pulse was 70 and her respirations were 16. If I were going to take her temperature, I would have done it orally, but I don't have a thermometer. And then we're going to do blood pressure. Put this pillow under your arm here. It's a little too loose. Check for 2 fingers, and I put it on 1 inch above her brachial artery, and it's still too loose. For her, I may consider using a child cuff because her arms are so small to make sure I get an accurate blood pressure, but I don't have one, so this will just have to do. Okay, there we go. 2 fingers underneath, good to go. Go ahead and rest your hand up, palm up, good. Okay, can you tell me what you usually run?
Usually 110.
Okay, so I would go 30 above that, but if she didn't know what she would run, I would be palpating for her brachial, and then I would pump it up, and then I would go 30 above the number where I first feel and hear her pulse. So, (106/64). If I was doing an orthostatic blood pressure, I would take it while they were laying down, after they were laying down for at least 5 minutes, and then I would take it again, sitting up 2 minutes in between, and then again standing up 2 minutes in between. Okay, so now we're going to do your skin assessment. So I'm going to do turgor here, which is pinching the collarbone, around the collarbone. Watch it go back, less than a second. She's good. I'm going to check temperature. Equal bilaterally, nothing too warm. Do you have any rashes or lesions that you're worried about?
No.
No? Okay, so normally if there were problematic areas like under the breasts or in any rolls or anything like that, I would want to check those carefully because they are moist environments that breed fungus. Okay, and I'm going to check your cap refill and your fingertips. Check for any clubbing. Less than a second. I'm going to check your toes going down here. Less than a second. Okay. Good. So now we're going to do your head. I'm going to palpate your scalp. Okay, good. And then go ahead, I'm going to feel your sinuses. Any pressure here, let me know. Good. Temporal artery. And then our joint. Can you open your mouth for me? Okay. Can you clench your teeth? Smile. Frown. All right, now we're going to do your eyes. So I'm going to check her sclera, which they're white, don't appear to have any spots. Conjunctiva are light pink and they are moist. So now I'm going to check Perla. So I'm going to measure her size of her pupils. Can you look at me, please? They're at a 6 and a 6. Now we're going to check your light reflex. So can you just look right over my shoulder for me and don't look into the light? All right, now can you look at the end of my pen? Follow it with just your eyes. Good. Good. Okay. Now I'm going to do ears. Outer structure is good. I'm going to go do a whisper test. Okay, so I'm going to say 2 numbers, whisper them, and she's going to tell me what she hears.
14 and 12. 13 and 17.
Okay, good job. Okay, so now I'm going to check her nose. I'm going to look at the structure of it. She doesn't seem to have any problems. We're going to do patency. Can you block one nose for me? Blow out. And the other one. Good, okay. And then we're going to do a smell test. Normally I wouldn't just have it in the bottle so she could tell what it was, but can you tell me what it is this smell is?
Aloe.
Okay, very good. So now we're going to check your mouth. I'm going to use my light and I'm going to check for any lesions on her tongue, gums, check her teeth, everything, roof of the mouth, base of the mouth. Stick your tongue out for me. Can you open a little wider? Thank you. Weird, Karen. Can you say ah? Okay, she does have tonsils. They're about a 2. And then I would normally check gag reflex, but I'm not going to stick anything in her throat, so we're not going to do that. Okay, so now we're going to do neck. Make sure it's symmetrical. And it is. Can you shrug your shoulders? Push against my hand. Good. Good. Okay. And then that is neck. So now we're going to do thoracic. Yeah. So I'm going to have you stand up for me and turn around. Okay. Can you take a deep breath in for me? Okay, good. Now while we're back here, I'm going to check your lung sounds. I normally would do this underneath clothing, but for privacy reasons, we're going to do it above. The clothing will cause crackling sounds, which are false. So every time I move my stethoscope, take a deep breath in through your nose and out through your mouth, okay? Go ahead. Okay, you can go ahead and take a seat. I'm going to check her front lung sounds. Again, every time I move my stethoscope, deep breath in through your nose, out through your mouth. Okay, now I'm going to listen to the 5 heart sound spots, starting with aortic. You hold your necklace for me. Okay. Pulmonic. Erb's point. Mitral. And then apical. I'm going to go under your bra. And I'm going to listen here for a minute. it's 74 for your heart rate apically. Okay, now I'm gonna check all your pulses. Go carotid. Both sides. Brachial. Radial. Popliteal. Posterior tibial, middle back ankle here. Dorsalis pedis on the top of the foot. And if I were doing the femoral, I'd have her laying down and it would be in the groin region. Okay, now we're gonna do abdominal. I'm gonna have you lay down for me. Is it okay if I lift your shirt up?
Yes.
Okay, so the first thing I'm gonna do is check for symmetry. Symmetrical, see if she has an umbilicus pulsation. She doesn't. And then I'm going to listen for bowel sounds. Starting in the right lower quadrant and working my way clockwise. Bowel sounds present. Bowel sounds present. Bowel sounds present. Bowel sounds present. Faster than the last time. So now we're going to do some light palpation for tenderness and lumps. So tell me if anything feels tender, okay? I'm going to go in a circular motion, starting the right lower quadrant around clockwise again. Anything hurt? No. Okay, there were no lumps. And I'm going to palpate for her bladder. Can't feel it, which is normal because you can only feel it when it's full. And then you can go ahead and sit up. Can you tell me what your day of eating usually consists of?
In the morning, I usually have a bowl of cereal, and then for lunch, I have nachos, and then for dinner, I usually have chicken with 2 vegetables, and then that's it.
And then what are your favorite foods?
Ice cream, potatoes, and green beans.
Okay, I like ice cream too. So, can you tell me when your last bowel movement was?
Yesterday
What did it look like? Well, yesterday in the morning or at night?
at night,
Okay, and what did it look like?
formed
Okay, that's good. And then how many times a day do you think you urinate?
3 to 4.
3 to 4? Okay, good. So now we're going to do your extremities. So I already checked them for temperature. She doesn't seem to have any edema anywhere, none in her ankles, anything like that. So we're going to do some range of motion and strength test exercises. So can you give me your hands? Push down. Okay, pull up. Good. Pull your legs against my hands. Push your legs against my hands. Oh, you're a little strong there. You push down. Pull up. Okay, good. Go ahead and stand up for me. Big circle with your arms. Straight up. Come back down. Go in front. Straight up. Okay, go backwards for me. Okay, good. Now I'm going to have you walk to the wall and back. Okay, you go ahead and have a seat. Okay, so I already checked cap refill and fingers and toes when I did the skin assessment part. So, gotta do my hand hygiene, and the doctor will be in to check on your knee in a little bit. One thing that I do suggest for you is that your lunch, you add a little bit more like meat and vegetables, so that way you're getting all of your food groups in there, okay? All right, so her bed is lowered in a locked position. Her call light is in reach. Her belongings are in reach. Can I see your ID band? Name and birthday, please.
Audra Berman,
Birthday?
February 2nd, 2002.
Okay, thank you. So your doctor will be in a little bit, okay?
Mhm.
It's nice meeting you.
You too.